I'm Gabby Saunders. I'm the Research Area Manager for eHealth Research here at Eriksholm Research Centre. eHealth is the use of technology to provide healthcare. By having eHealth and technology, we open up many new horizons. It means that we can collect lots and lots of data about a particular individual. We can collect the data from the hearing aids they're wearing. We can collect the data from their cell phones. Where are they? How are they using their hearing aids? We can collect physiological data, and we can have them give us input as they go, reporting on real-world daily occurrences. From a clinical perspective, lots of data means we can really validate decisions that we're making clinically. So in other words, our research is going to help us make evidence-based clinical decisions. Evidence-based practice is the way to go. You want to make sure that you're doing the right thing for the person when they come in. Something else that we're being able to do with such big data is make, on a bigger scale, public health policy decisions. Right now, when you make a policy decision, it tends to be somewhat political because we don't necessarily have the data to support the decision we're making. With our big data sets, we'll be able to have a policymaker devise a potential policy and then model what the outcomes of that policy would be. Over time, we can collect more data and determine what the implications of that policy were and determine whether it needs to be tweaked. There is a lot of information out in the world, which means that patients are more educated when they come to a clinical appointment. And we need to make sure that the education that's out there is effective and correct and efficient. We can use eHealth to provide 24/7 service. But we need to know, what do patients want from the service? In addition to finding out what our patients want is really critical. We have support of our clinicians, the audiologists, the healthcare providers. What information about the patients do the clinicians want? How do they want to see the information from the patients? What kind of interface do they want? Finally, eHealth can also present challenges. There are certainly the ethical and privacy challenges, which, with our research, we will obviously do our best to address. But then the other is what's known as the digital divide. So whilst we talk about how eHealth provides greater access to everybody, the reality of the situation is that right now, people who are less educated, people in rural areas, people with less money, have less access to eHealth and technology. And so we also need to work on how can we ensure that everybody out there has access to all the wonders that eHealth can provide. The eHealth research team is a very interdisciplinary group. We have engineers who can address the technological side of eHealth. We have a business and marketing person who can address how what we learn can be applied in the real world. We have psychology. We've got audiologists who are well aware of what the clinicians out there need and want and expect, and are very sensitive to patient needs as well. I'm a great believer in using knowledge that's already out there. And by having this interdisciplinary team, we can pull in knowledge from all different fields and combine it to make a more efficient and effective group. The exciting thing about working here at Eriksholm is the possibility that one's research will actually be put into real-world practice because we have the support of a large organization that has the capacity to take Eriksholm research and apply it in the real world. What I hope to gain from my eHealth research is that we can optimize hearing healthcare outcomes through ensuring that patients and clinicians receive solutions that they understand and know and care about, that we can increase access to populations that right now are underserved, and that we can optimize how we use technology throughout the process of hearing rehabilitation.